All right, welcome everybody to our Strong Retirement Club Health and Long-Term Care as You Age. It's interesting, one of our club members, she just had surgery, so she won't be attending tonight because she is healing, and this is something, as she's experiencing right now, for her to dive into at some point. So this is one of my favorite topics, is one of the club's favorite topics historically. This brings up a lot of discussions, and what I'm going to say is next month, we're not going to do one of our group things. I'm actually going to meet with everybody one-on-one, obviously virtually, but we're going to talk about this one-on-one. We'll also see what you'd like to see for the rest of the club, what professionals you'd like to engage with, and what to focus on for the remainder of the year. So again, after tonight, we'll do one-on-ones, and I'll also talk to everybody about their comfort levels for us all to get together. Maybe September we can shoot for, which would be awesome. All right, so let's dive into this. Here we go. Okay, so pre-Medicare. Right? Yeah, we're going right into it. Pre-Medicare. So pre-Medicare, Lynette, you don't have to worry about this, but women who retire before 65, and I had a discussion with this with a couple earlier today who are clients, and they're looking at, should they retire before 65? Is it worth it? Because of how much money it is. And health insurance base their premiums on 4 criteria: age, geography, family composition, obviously, and tobacco use. Okay? Plans cannot have lifetime benefits anymore. In 2016, the annual out-of-pocket maximum spending limits were $6,850 for individuals, $13,700 for a family. In 2016, the IRS out-of-pocket limits for high deductible plans are $6,550 for individuals, $13,100 for families. Those are becoming more and more popular because they save you money for premiums. So each month they save you money, but if you have an expensive year, surgeries, rehab after, physical therapy after, specialty doctors, you can end up spending $13,000 for your family. So each year, if you can be strategic with when you have your surgeries, those type of things, it's always good to reevaluate what type of plan you need, what are your healthcare needs for that year or concerns. Affordable Care Act, so there's a great resource, healthcare.gov there. But here's a quote for 60-year-olds, income 25 to 50,000, low income. Your monthly premium would be $240 with a deductible $4,400. There's another one for $410, no in-network, no deductible. What we've seen, especially in New Jersey, are you're looking at $800 to about $1,000 a month, so about probably $10,000 a year for pre-Medicare insurance. It's one of the biggest reasons women work until 65 is to get the health care coverage from their employers. It's such a big expense, and they'd rather use that money to travel, to save, to pay down debt, than for it to just go to health insurance. It's also one of the big reasons why you see the early retirees typically are teachers, police officers, people who have health care coverage into retirement, although you're seeing less and less of that. That's for sure. And then there's the Medicare enrollment period. So for Susan and Kathy, who are going to be retired probably around that 65 time frame, there is this window to sign up for Medicare. It begins 3 months prior to your birthday when you turn 65, the month you turn 65, and then 3 months afterwards. So it's a 7-month period to sign up. Now let's say you're still working past 65 and your employer has health insurance. Well, you let them know that you're Medicare eligible. They might have you sign up for Part A because it's free. That's a hospital care. And then they'll cover the rest of it. So if that's the case, when you do retire, you're going to have a special enrollment period. So you want to make sure that if you work past 65 and you're not on Medicare yet, you want to enroll once you retire, otherwise you get penalized. Same thing if you retire prior to 65 or right at 65, you want to enroll, because each month you delay past that enrollment period, you can get penalized, and those penalties stick with you for life. Okay, like I said, it can be up to 10% for every 12-month period when you are eligible for Part B, but didn't enroll. Okay. These are some cost assumptions that we do when we put Medicare into our goal plan, when we project out your retirement, if you were to work with us as clients. There are all these different pieces that we put into the plan, and that's something we talk about in the next section. But this just goes into the healthcare piece, the Medicare. Not talking about nursing home, assisted living, anything like that. But you'll look at Part A, like I said, is free at hospital. Part B, your doctor's visits. So it'll be about $1,600 a year, depending on your income. So if there's a reason that all of a sudden you have high income one year, let's say you took a lot of money out of your retirement account, that got added to your income, bumped you into a higher tax bracket, your Medicare Part B premium could go up a lot. And I've seen it happen.
Yes.
It doesn't mean it will be permanent. You can always say this was a one-time circumstance and try to fight it to lower it back down. But that can happen, as I guess Lynette, you have said.
Well, no, it was just something that they put. I'm echoing myself. Something that they put into in just recently, where part of you have an additional charge for the Medicare and the Part A and the Part D, or Part B and the Part D, based on your income. And the first year they did it, mine was like 180% more. But they do that. They calculate it each year now.
Yes. So it's one thing to think about if you are to get a severance package the year you retire. Can you push that severance package off until the next year? Can your retirement date be December 31st, and then January 1st the next year you get your severance package? Because, like Lynette, you said, you add your income plus your severance package, maybe that's 6 months of income. That's a lot of income. You're going to be pushed into a very high tax bracket, so you're going to be paying extra taxes on this money. And your Medicare insurance, that's going to go up too. So you kind of get a double whammy there. So these are different things to think about timing-wise. I would say we always want to make sure timing works in our favor. And I've had a lot of clients do that, where they'll take sick leave days, they'll do whatever they can, delay the paperwork so that they get the severance, the vacation time pay, all of that stuff the next year, to spread out the tax burden of it, keep them in a lower tax bracket, and also prepare for the Medicare premiums. Then they're saying Medigap, about $1,500 a year for that. So that is the piece of insurance that Medicare won't cover. If you have a good supplemental policy, a Medigap policy, and we have different professionals that everyone can talk to figure out, do I do a Medigap or a supplemental policy? They're two different things. But if you get a good one, you probably won't have a ton of out-of-pocket costs. Now, our program projects about $1,600 of extra costs for out-of-pocket, deductibles, co-pays, all that type of stuff. So total cost about $5,000 per person per year. That's pretty typical. The big thing that people don't think about is the healthcare inflation, how quickly the cost of healthcare goes up each year. It's almost on the same track as college inflation. So regular inflation is around 3%. Healthcare inflation right now is 5.1%. We've seen it at 6 and 7% some years. Right now it's a little bit lower at 5%. And the average couple will spend $280,000 in health care costs if a man lives to 87 and the woman to 89. That's a good chunk of change for health care, and it's a big thing to look at funding-wise. How are we going to fund the health care? And it has to be priority. We have to have this good coverage, otherwise you're putting yourself at a lot of risk. So Part A, it helps to cover hospital care, limited nursing home facilities, hospice care, a little bit of home health care. It's financed by Medicare payroll taxes that we've been paying for all these years going forward. Part B is doctor bills, outpatient, emergency room services, ambulance, diagnostic tests, labs, durable medical equipment, and it's financed using general tax revenues and premiums collected from participants in the plan. Okay. Then Part C, participants in Medicare Part A and Part B are eligible for expanded care plans like an HMO or PPO run by Medicare-approved private insurance companies. Most plans offer prescription drug coverage, and then here's a great resource to look at supplemental versus Medigap. Medigap is more like an HMO. You know, you have your in-network, supplemental, more like a PPO. More flexible, more range of doctors, different states. So if you have a certain specialty doctor that you love, you might want to do a supplemental to make sure that you can use them. Okay. And Part D, so those receiving Medicare Part A and or Part B are eligible for this voluntary program that covers prescription drugs subject to copays, deductibles, and many private company plans are available to choose from. So that's a very brief overview of Medicare. They make it very complicated, but it really comes down to 4 parts, Part A, Part B. Part C is really on us to figure out how we want to navigate that, a Medigap or a supplemental. And then the Part D is easy to remember because it's D for drug, right? Okay. Now here's a big topic, long-term care. So what is long-term care? I'm sure everyone has experienced it in some capacity. A parent, a sibling, a spouse. It's personal or custodial care. Assists people with activities of daily living, include eating, bathing, dressing, using the restroom, moving from place to place. Skilled care is the treatment of medical conditions provided by licensed professionals, nurses, therapists, physicians. It can take place at the home, a community, assisted living facility, or a nursing home. What are the average costs? So obviously this is over the United States. New Jersey, much more expensive than these average costs. But there's always an option if you move out of state. It could be a lot cheaper. You go to Pennsylvania, it will be cheaper. So adult daycare, about $18,000. Assisted living in a 1-bedroom, $45,000. Homemaker services, $47,000. Nursing home, semi-private room, $85,000. Private room, $97,000. In the Bridgewater area, New Jersey, you're looking at $10,000 to $12,000 a month. So obviously a lot higher than these projected ones. If you go to South Jersey, it's going to get cheaper. If you go out to PA, it will be cheaper. One of the biggest things to think about, and I actually do have a contact who can help people find the right home for them or a relative, a loved one, you want to look at how close are you to loved ones. So don't think price is the only thing. You also want to know how close is it going to be to people who are going to be visiting you. How important is that? I have a friend whose grandmother was out in Lancaster, PA because it was very cheap, but she didn't get to see anybody. So she ended up moving back to a nursing home around here because they could see her maybe, once a month, every other month, because that is a far drive among having your regular life, work on top of it. Okay. Are the odds on your side? So there's a 58% chance of needing long-term care for an average of 2 years. 15% will need 2 to 5 years. 1 in 7 adults will need for 5 or more years. Once you hit the age of 65, there's a 70% chance you'll need long-term care at some point in your life. 80% of nursing homes are women. 70% of long-term care insurance claims are for women. And a big piece, I think, is women are living, historically we've lived longer, but we're also the caretakers. So we've been taking care of the spouse, and then there's nobody left to take care of us. So we then go into the nursing home. Okay. So why utilize insurance? A lot of different reasons here. And I had a call with this couple earlier today about it. And they brought up long-term care, and I said, okay, well, there are different ways to fund it. There's different ways to pay for it and protect your assets. But you really want to come down to, you know, how much of an inheritance do you want for your children? How much do you want to protect against the chance of becoming a burden on your children? Not just the financial burden, but really navigating it, finding the right home. How are you going to pay for it? What are you going to do with the house? Are you going to sell it, rent it out? How are you going to pack up all the belongings? You know, who's going to be the point of contact? Who's going to be directing everything? That's the bigger burden that people forget about, and I see it all the time. And when you don't plan for these things, the guilt, the stress that you put onto your children, the next generation, trying to figure all this out, and I see it all the time, especially with the guilt. Feeling guilty that they can't take mom and dad into their own house to take care of them. The guilt that they can't find the nicest place or one that they can afford. The guilt that this is what it's come to. And then the guilt afterwards of not being able to see them as much, too. So these are different reasons I've heard it. You know, avoid being a burden to other family members. That's a huge one. Protecting family finances. So if having a legacy is very important to you, insurance is definitely a good avenue to explore. Avoid effects of potentially higher taxes. Provides liquidity, obtain security. A secure mind. You think about it, when you're working, you have disability insurance to protect your greatest asset, your ability to earn income. In retirement, your greatest assets are your assets, your retirement funds, your house, your equity. Long-term care insurance is there to protect those things. Ways to pay. So Medicare, besides hospice, they really won't pay for a nursing home. The condition needs to be improving. Medicaid, you can use this, but you need to be broke. Okay, there's a look-back period of 60 months. The penalty period will not begin until the transfer has moved to a nursing home, spent down the assets to that $2,000 amount, applied for Medicaid coverage, and been approved for coverage except for the transfer. Okay. Now, if you are married, there's a spousal amount that's higher than the $2,000 that you can keep. It's about $150,000. Still not a lot of money today's day and age, especially in New Jersey. Okay, so Medicaid is you're broke. So sometimes you end up going on to Medicaid after self-funding a nursing home because you spent through your assets. There's no money left. Now Medicaid will pick up the bill, and then there's not going to be an inheritance for your loved ones. You know, there's not going to be any money left for any extra care you might want or need, or to have a better room, a private room, those different things. So some things just to think about. Then there's different types of insurance policies. There's a life insurance long-term care combo. There's an annuity long-term care combo. Withdrawals from these policies are not taxable. Life insurance will retain its tax advantages when combined with long-term care insurance. So I'll give you a few examples of previous club members, what we've done. So outside of the club, when they work with me as clients, one woman, she had money just sitting in the bank. It wasn't doing anything for her. It was actually working against, and this is something we talk about next section, but money sitting in the bank, you're not keeping up with inflation, right? So you're slowly losing the purchasing power of that money. Any gains you do have, that 1% interest they pay you end up having to pay taxes on it. So it ends up really being 0.7% that you're earning on your money, roughly. So we looked at different options to better use money just sitting in the bank. And there's an annuity where the money would grow about 3% each year. If she went into a nursing home, whatever amount of money was in the annuity at that time would triple to help pay for the nursing home. And that gain is not taxable. As you can see here, withdrawals from them are not taxable. So let's say it was $100,000, now it's $300,000. That $200,000 gain isn't taxable to them. What's nice about it is if she never needed the money, she could just take the money out of the annuity down the road. She can annuitize it, and basically it become a pension for her. So taking money out of the bank was working against her in two ways. Now we have something that's going to keep up with inflation, help pay for long-term care, is very tax efficient, and it also helps diversify her investments because it's not tied to the markets, not tied to the bonds, and this is going to be very steady. So looking at all the benefits of it, it was working for her in 4 ways versus sitting in the bank working against her in 2 ways. So that was almost like a 6-point swing for her. And I've done similar things with life insurance for some of the women, doing a combination life insurance long-term care combo. Even for women who are single with no children, depending on your age, there's kind of a breaking point where if you're younger, the life insurance will actually pay you more benefits in long-term care versus the annuity. So there is kind of a breaking point, and that's where we dive into, outside of the club, to see where's that breaking point, when will it make more sense to do the insurance versus the annuity, vice versa. Okay. Or there's the traditional long-term care policies. These are very customizable because you can pick a policy that will pay for 2 years, 3 years, 5 years. They don't have the unlimited pay anymore, and unlimited benefit period anymore, because those, they realized they got on the hook to pay for way too much expenses. You can get ones for $100 a day, $300, $600 a day. You can get ones with inflation riders, 3%, 5%. And what they say is if you need long-term care, so if you can't perform 2 or more of the activities of daily living, they will pay your benefit, okay? They will pay the $200, $300, whatever benefit amount you picked and you've been paying for. They'll pay that money to you, and then you would pay the nursing home, the home health aide, whoever it would be, for that length of time. Okay. Or you can self-insure, or you can ask someone to pay for you. I haven't seen that work out well for anybody, nor do you want to put that burden on anybody. Logistics. And what I'll do when I schedule all these one-on-ones with everybody, we have a whole worksheet to help you figure out the logistics, really your whole health plan, from health to long-term care to legacy planning. It's so much easier when you break it down into the different stages of retirement, right? Honeymoon, relaxation, reflection stage, and then knowing exactly what you need to do, when you need to do it, and how to keep moving forward, what professionals to use, who those professionals are going to be. It's going to be so much easier, and you can just basically give it to your loved ones or have it someplace where they know it is, and like, this is the plan. It's all set. You don't have to figure out anything. You just have to help me implement it. And as I always say, having a plan in place leaves you less vulnerable. And this is so true. The amount of elder abuse fraud that is out there is disgusting. And the people, they can sense when people are vulnerable, when they don't have a plan, when they don't know what's going on. They might be alone, they might be left alone. They can sense it right away, and they're the people that they go after. So having a plan in place and having professionals is that safety net, that safeguard for you. And I'm always emphasizing being proactive. Don't wait until a fall happens, an accident happens. Be proactive to prevent the fall. Okay? So there are so many different professionals that you can rely on and count on, from bill pay, estate account attorneys, or even elder care attorneys, organizers for your home, for moving, for selling or donating things, accountants. I have one organizer, and she's great, Cecilia, because sometimes how she will donate and sell things will almost not pay for herself by the amount of money she's going to raise you by selling things. You can prepay into some of these nursing homes a plan for your assets, right? How are you going to fund them? How are you going to protect an inheritance one day? And also, what do you want to do with your belongings? You know, not just your couch, but really the things that have been passed down for generations, or something that's really important to you, given to you by your mother or your spouse, right? How are you going to continue traditions? If something simple, even as recipes and stuff. So they're, you know, really leaving a legacy of love and finding a way to validate relationships and continue those things. So even if you aren't able to keep all the stuff, there's so many ways, and I have a woman who can help you with, you know, all the photographs, or maybe it's a silk scarf, or myself and all my cousins were actually baptized in my grandmother's baptismal gown. So my grandmother, her sister, all my aunts and uncles, my dad, all my cousins, my brother, myself, were baptized in the same gown. And about 6 of her great-grandchildren, including my daughter, were baptized in that gown. So there's no way that gown is going to physically survive the decades, but there are ways to preserve it, or, you know, put it in a thing, even if it's not the physical gown, so that we remember that, how special that is to us. Okay, so different resources, and again, you're going to have these on the worksheets too. So pre-Medicare health insurance, Medicare enrollment periods, and then the Medigap plans. Okay, and again, our clients at Raymond James, we have great resources for Medicare. We have a whole consulting team to help people navigate that. Every year it's definitely good to look at, because your needs change, your drugs change, and your needs might not change, but every insurance company, they align with different pharmacies every year, and it changes. So, as you probably know, it's very good to reevaluate it. Even if you aren't a friend of RJ, I do know Medicare consultants outside of Raymond James who can help you too. And then different professionals. So like I said, I have so many different professionals. You know, Chris LaDon, Reminiscence, she's fabulous. My mom, I always give gift cards to my mother-in-law and my mom for her work, because she takes, you know, old films, old videos of family, and there's no way you can view them now. She'll put them, you know, on a disc. She'll put them in a Google Cloud so that your whole family can enjoy them. We've done that with my mom's, and then my mother-in-law, she took, my father-in-law played in a minor league, professional baseball. She put this whole book together, and it shows, you know, his career in the minor leagues. It has his first check he ever received, his first contract. So not just the pictures, but that type of stuff too. It was beautiful. Stephanie Heller is an amazing at QuickBooks, bill paying, as you get older, just having somebody else to take care of that stuff. We have several estate attorneys, accountants, health and fitness coaches, all here to help, and you might not need them now, but it's just good to have those resources on hand. Okay, so that's it for tonight. Like I said, I'll send out the worksheet, schedule time with everybody individually to go through it, and then also to prep for the rest of the year when we're going to get comfortable seeing everybody in person, because I know it is a different feel when we're all together in one room, even though we have a little bit more of an intimate group this year, which is fine. It's been a crazy year, but we can get so much more stuff done having an intimate group. So hopefully we can find a time, maybe September, October, that we can do that. Even if we need to be 6 feet apart, we can still make that happen and stuff. So thank you, Lynette, for being on this call. We'll get this to Kathy and Susan along with the workbooks, and I will talk to everybody very, very shortly. I hope everyone has a fabulous night. And again, we'll go even deeper into these and how health and long-term care, each individual's plan, will be so helpful for you, but more importantly for your families. All right. Have a good night, Lynette.
Okay, thank you.